Okay, welcome back. It's 12:30. Hope everyone enjoyed their lunch. Can somebody please make sure that you're able to hear me and able to see the PowerPoint still?
This is Bernice. I can still see and hear.
Thank you so much, Bernice. So this is where we left off at the procedures and the manual update. So this is going to be a very important section. I'm sorry, I was on mute. Sorry, I was just talking and it was on mute. Thank you for letting me know. So, like I said, this is a very important section. So you're going to have to make sure that you understand this section. So if you need to take out some of these slides for this particular section, please take them out because this is going to tell you exactly what to do based off of the situation that you are presented with. So the first thing we always do is we screen the individual into GAMIS, and we're trying to make sure that that person is not already active on medical assistance, and to also get their ID number if they ever had Medicaid before in Georgia. When you're screening them into GAMIS, remember I told you you need to inquire about any previous names that they may have applied with. So like I said, sometimes people use their last name change, maybe even their first name change. Whatever you need to do to kind of verify their information, make sure you inquire about all particular names that they could have received, or either making sure you can also screen by their social security number, date of birth, and all of that. So we just have to make sure we're not creating duplicate ID numbers for individuals. So that is the first step you need to do, because once you screen on GAMIS, then it'll tell you what exactly steps you need to take. Because if it's SSI, remember you complete the SSI pregnant women update form and send it to the PE Corrections email address. If it's women's health, remember, refer them back to DFACS to go online or either call their caseworker, or you can send an email to the women's health email address. If it's P4HB 180 or 181, you will do the normal PE process to make a determination. If the individual is eligible, you're going to add the PE to GAMIS, and then you're going to send the PE manual update form to the PE Corrections email address. So that's why you have to screen them to find out exactly what procedure you're going to need to take. So step 2 says if the applicant is not active, or the applicant is active on like P4HB 180, 181, then you're going to complete your 632 and all other required forms, including the 94A, and you're going to go through the eligibility requirements to see if they meet all eligibility requirements. So they have to meet all eligibility requirements, not just some, not just one. They have to meet all requirements. If they don't meet all the requirements, then they're not eligible. They have to meet the U.S. citizenship immigration status, have to be a resident of Georgia, have to meet the income limit, and have to be pregnant. So if they don't meet all 4 of those criteria, then they're not going to be eligible. So if they are eligible, like I said, you're going to add the PE to GAMIS, inform them about their PE period. Remember, the PE period is the start date through the end date. Inform them that you're going to send their full application to DFACS so they can process it to make a determination. You're going to provide them with the approval notice, the 634 that we looked at, the temporary certificate that you print from GAMIS, the quick guide, the understanding medical assistance booklet, The HIPAA notice except for the signature page, because remember, that's the only page you keep. A copy of the notice of ADA and the P4HB information. So that is for each individual that is eligible. And also I want to say if they are doing the interview in the office with you. In a few minutes, you're going to look at another way you can accept PE application, which is going to be done over the phone. So this procedure is particular for those who are in the office with you. If the applicant is denied because they did not meet at least one of those requirements, if they are denied, you can let her know that if her circumstances changes, she can come back and apply for PE again. But she can only apply for PE once every time she's pregnant. So let's just say an individual applied, got approved for PE, then you sent the application over to DFACS. Let's say she come back in November and she's saying that she doesn't have Medicaid, she's trying to apply again. Well, if you ask her, sometimes they're not going to be honest with you and let you know that they've already applied and got approved the first time. But if you try to put her in the system, you don't know because the system is really not going to tell you. But if you try to put her in the system is probably going to give you an error message saying the pregnancy is within the last 7 months. That means she already has a due date out there. So either we still have her original due date when she applied the first time, or either she may be pregnant again. She may have a miscarriage from that previous presumptive, but she's pregnant again with a new pregnancy. So either way, you're not going to be able to enter the PE into GAMIS. So in those circumstances, if it's the same pregnancy, meaning that is not a new pregnancy, nothing happened to that first pregnancy when she applied for PE, then we're going to have to research that case to see what happened to the full application. But if it's a new pregnancy and you're trying to do it, then that's when you're going to have to fill out a PE manual update for us to add the PE to GAMIS. So if her circumstances changes, she can reapply. You're going to provide her with the notice of action, but it's going to be the denial notice. You're going to provide the HIPAA notice, the notice of ADA, and the P4HB information. And they still have to complete the full application. You send it to DFACS, and they will make a determination to see if she's going to be eligible for full Medicaid or not. Just because an individual is approved for presumptive does not necessarily mean she's going to be approved for full Medicaid. So you don't know that, because there is certain information DFACS may have to verify, especially if we have conflicting information. So a lot of times they may not be truthful to you since you're accepting their statement. They may not be truthful to you about what their situation actually is. And so when the application goes to DFACS, they're able to verify information. So if the information is kind of questionable or conflicting, DFACS will verify that information. And if the customer needs to report or either return back some verification to DFACS, they have to make sure that their address is up to date so they can get that letter so they can know what they need to provide back to DFACS. And vice versa, just because they were denied with you does not mean they're going to be denied with DFACS. So you all make the presumptive eligibility determination, and then DFACS makes the full eligibility determination. Okay, if you screen an individual and they're active on these 8 categories that you see listed here on this slide, these are the procedures that you need to take. The first one we have already talked about several times. If they're active on P4HB 180, 181, you treat them as if they don't have Medicaid. So you're going to complete the PE process as normal, make a determination to see if that individual will be eligible or not. If the individual is eligible, you're going to add the PE to GAMIS. And then when you send the packet to DFACS, or either before you send the packet to DFACS, you need to send an email to the PE Corrections email address with that PE manual update form, the 632, And if the application was done over the phone, the attachment A, we're going to look at in just a moment. If the individual is active on women's health, remember, refer them back to DFACS to report their pregnancy. If the individual is active on SSI, all you have to do is to complete the SSI Pregnant Women Update form and send that to the PE Corrections email address. If the individual is active on QMB or SLMB, which is Qualified Medicare Beneficiaries, or Specified Low Income Medicare Beneficiaries. But if you just see they're active on QMB or SLMB, you're going to do the complete the PE process as normal. You don't have to do anything different. So these you're just going to treat just like a person that is not active. If an individual is active on QI1, which is qualified individuals, if they're active on QI1, these individuals cannot be approved for another aid category while they're active on this particular aid category. So for these particular individuals, the only thing you're going to do is you're not going to do a PE application on them. Only thing you're going to do is to have them complete the 94A form, just the 94A. Once they have completed the 94A form, you're going to send that directly to DCH. Don't send that to DFACS, send that directly to DCH. In the subject line, you can just put QI1/pregnant applicant. And once we receive that application, we will route it over to DFACS so they can process it and get that individual determination made. So again, if they're active on QI1, do not complete the PE process, do not complete a PE application. Only have them complete the 94A, and you send that 94A to the PE Corrections email address. Are there any questions over the specific procedures you need to take if you have P4HB 180, 181, Women's Health, SSI, QMB or SLMB, or QI1? Any questions over what steps you need to take if an individual is active on one of these aid categories? Remember, if it's not one of these aid categories and it's one of the aid categories that we saw in that chart on slide 16, remember, refer them back over to DFACS. Okay, I'm going to assume no. If you have an individual that's active on inmate Medicaid, these individuals should have been released. That's why they're applying with you. But remember, I told you at the beginning, if they're still incarcerated, no, they're not eligible. But if these people are on inmate Medicaid, but they have been released, then they can apply for a presumptive. So you're going to complete the process as normal, complete the 632 and all the required forms, and you're going to determine if they're going to be eligible or ineligible. The only step you would not take is if they're eligible, you're not going to add them to GAMIS. What you're going to do is to ask them what date they were released. And once you do that, you're going to send an email directly to me. And you're going to attach just the 632. And I should have put the attachment A, if applicable. If you did it on the phone, I would need that too. But you're going to attach the 632 and give me the release date. And then what I have to do is I have to verify that this person actually has been released. And once that has been verified, then DCH will go in and add the PE to GAMIS. So that's the only thing you're not going to do. You're not going to add the PE to GAMIS if that particular person is eligible. You just let them know I'm going to have to forward your information over to DCH, and someone will be in contact with you within a few days to let you know what the results were. So once we get the information, we verify the release date. If the release date is verified, we will add the PE to GAMIS. And then we will also reach out to the member to let them know, hey, your Medicaid is now active. But you still going to send your PE packet to DFACS. And remember, all other aid categories, refer them over to DFACS. If you have an individual that got approved for presumptive because she was pregnant, but then let's just say later on she comes back, or either she does a test with you all and she finds out that she's no longer pregnant, then you would just have to send that information to us to let us know this lady is no longer pregnant. Can you terminate her presumptive? So in it, the subject of the email, you could just say, terminate PE, not pregnant. Give us the member's name and her ID number. You don't have to attach a copy of the negative pregnancy results. You don't have to do that, but just give us her name and her ID number, and we will go in and terminate the PE. Okay, number 5, you may have this sometimes, so make sure that you understand this process. So if you have an individual that applies for PE, got approved, whether it was at your health department or at another health department, and now that PE has ended. But remember, they apply for full Medicaid as well. So that means if the PE has ended, that means either the application from DFACS was denied, because if it was denied, we do not get that information in GAMIS. So GAMIS is not going to show you that application was denied. So in that case, that's when more research has to be done on the gateway side, which you all really don't have access to. So you're going to have to forward that information over to me, and I'm going to have to research that particular individual to see what's going on with their application. Either the application was denied, the application wasn't processed, or the application was processed but in error. Like, there are so many different reasons. I have to just research to actually see what happened with that full Medicaid application. So in that case, what you're going to do is, if the individual applied at your particular facility, you're going to try to locate that original PE application packet, and you're going to send me an email attaching that packet to the email. If the individual did not apply at your office, or you cannot locate the PE packet, you're going to still send me an email, but you just won't have an attachment. You will send me an email. Please give me a brief description of why you're sending me this email, because I get so many emails. And if you just send me an email with an application attached to it, but nothing to tell me, explain what's going on, I'm not going to know what to do with that application. So you have to give me just a brief description of why you're sending me this email. You can say, hey, Kanita, this lady came in. She's saying that her Medicaid is no longer active. Can you research it for me? That's all you have to say if that's all you want to say. But please give me a brief description of why you're sending me that particular email. And what I would do is, and some of you all on this call know that you've had to send me emails in regards to this. I try to tell you what's going on. I will research the case and say, hey, I researched the case and this is what's happening. Or if it was denied, I'll tell you what happened and you can relay it back to the applicant. But if it's something that DFACS needs to do, then I will let you know, sending this information over to DFACS. And I always ask them to reach out to the member if they have to do some on their side. So don't worry about that. I always tell them to reach out to the member. Are there any questions over the procedures that we went over so far? Does everybody understand the different types of procedure you need to take based off of what the individual has? If they have women's health, if they have SSI, QMB, P4HB, whatever, make sure that you understand what particular procedure you need to follow.
Anita, could you possibly go back over the beginning of that form, please?
Tell me what slide.
Right there.
Okay. You want me to go over the whole thing, or what do you want to specifically go over?
That page and the page after.
Okay. So again, when you're screening, this is when you're screening an individual. You haven't even started the PE process. This is when you're screening. And you'll see the screenshot in just a moment. We'll get that later on down the road of the screenshot of what you'll actually see. So if you go into GAMIS, you know how you do an eligibility search. You put in either their name, date of birth, and the pay through date of service, or either their social security number. Once you put that in, if they were ever known to the GAMIS system, GAMIS going to come up with the last information we had for them. It's going to show their ID number, their name, the address. If they are active, well, if they're inactive, it'll say inactive. If they're active, it's going to say active. And then over up under the column that says A category, it will tell you what A category they're active up under. So if you screen an individual and it shows they're active on P4HB and the A categories are 180, 181, you're going to complete the PE process as normal. So you're going to treat them as if they're not active. So that means you're going to do an interview with them to complete the PE application, the 94A, the 5460. You're going to do all of that. You're going to make a determination to see if they are eligible for presumptive or not. If they are not eligible, of course, you're going to get them a denial notice and let them know if her circumstances changes, you can come back and reapply. If they are eligible, you're going to add the PE to GAMIS. Once you've done all of that, then you're ready to send an email to the PE Corrections email address with the PE manual update form that we haven't went over yet. So hold on to the PE manual update process. You're going to send the PE manual update form. You're going to send the 632. If you did this application over the phone, which we haven't went over that process yet either, you're going to send the attachment A. And then you're also going to send the whole PE packet to DFACS. So that's for P4HB 180, 181. If they're active on Women's Health, refer them to DFACS to report their pregnancy. They can go online. They can call the call center, the 1877 number that you seen earlier, but it's 1877 423 4746, or they can report it to their caseworker. Also, you can send an email to this Women's Health email address to let them know, hey, can you reach out to this lady? She's trying to report that she's pregnant and she's active on Women's Health. If you want to do that, you're more than welcome to do that. But those are their options if they're active on Women's Health. They're active on SSI. Remember, you're not going to complete a PE application on them. The only thing you're going to do is to fill out the SSI Pregnant Women Update form that we seen earlier. Fill that form out, and you're going to send that form to the PE Corrections email address. And when a person is active on SSI, do not tell them we're going to switch their SSI Medicaid to pregnancy Medicaid, because that's not what we're going to do. We do not close out an individual on SSI Medicaid and switch them over to pregnancy Medicaid. You just let them know, I'm sending your information to the Medicaid state office or either DCH, however you want to put it. You say, I'm sending your information over, and they're going to update your pregnancy information in the system, because that's all we're going to do. We're not going to switch them over to pregnancy Medicaid. We're just going to go in and add their pregnancy information to the system. So therefore, when the claims are submitted, GAMIS will see that they have that pregnancy information in the system, and any pregnancy related services should be covered, that are covered. If they're active on QMB, SLMB, it's just the normal process. But I just wanted to specify that out because I get questions on what do I do if a person has QMB or SLMB, what should I do? So you just have them do the normal process. There's nothing differently that you have to do for them. Just complete the normal PE process. If the individual is active on QI1, you're not going to do a PE process on them. You're not going to do a PE application on them. Only thing you need to do is to have them complete the 94A form, which is the full Medicaid application. You're going to send that 94A to the PE Corrections email address. Any questions over that particular slide?
No, just clarification. Thank you.
You're welcome. Next slide. If they're on inmate Medicaid, you have to ask if they have been released, and they have to give you the release date. You can do the PE application on them. You're going to do the PE application and all of the other required forms. Make a determination to see if they're going to be eligible or not. If they are eligible, you're going to send an email directly to me, attach the form 632, and if applicable, the attachment A, and you're going to give me the release date. Let them know I'm sending your information over to DCH or the state office. Someone will be in contact with you within a couple of days. Once I have verified their release date, then I'm going to go in and add the PE to GAMIS, and I will reach out to the member to let them know their Medicaid is now active. For all other aid categories that we did not go over, for the ones that are listed in that chart back on slide 16, you're going to refer them over to DFACS. If an applicant is approved, but later finds out she's no longer pregnant and we need to terminate that PE case or that PE coverage, then you just send an email to the PE Corrections email address with her name and her ID number. Again, if someone is approved for PE, but later comes back to you and say that their PE is no longer active, they no longer have coverage, you're going to send me an email. If the individual applied at your office, you're going to try to locate the PE packet. If you can locate the PE packet, you're going to send that as an attachment. If you cannot locate the PE packet, you're still going to send me an email, or if the individual did not originally apply at your office, you're still going to send me an email. In the email, the body of the email, please give me a brief description of why you're sending me this particular, or why you're sending me this email or this particular application about this member. Any questions over that?
Not for me, thank you.
You're welcome.
Hey, Kanita, we do have a question in the chat, and I know previously you've talked about this before, but the client is active on pregnancy, but is from an already terminated pregnancy. So they've come back in. How do they proceed? So they're currently active, and maybe she may have lost the baby, or DFACS hasn't updated the case, but she's currently active on pregnancy Medicaid, and she's coming back into the health department because she's pregnant again.
Okay, that case has to be, DFACS has to update that case. So that is a change she has to report, because she still has an active case with DFACS. That is considered a change. She would need to report that to DFACS. So you're going to have to refer her to DFACS, either go online or call the 1-877 number, but she has to report that information to DFACS. There's nothing that you can do, because if you screen her, you're going to see that she's active on full Medicaid, and we do not do presumptive application on people that are already active on full Medicaid, regardless if this is a new pregnancy or not.
We have a question. It says PE has SOB, but I'm not sure what SOB means.
Okay, whoever asked that question, can you please clarify what you mean by SOB?
Schedule of benefits.
I'm not sure exactly what you're trying to say. Maybe kind of rephrase your question, because we're not exactly sure what you're trying to say. You can let me know once it comes up, Teresa.
Okay,
I'm going to more.
Mm-hmm.
Okay, so for your PE packet, remember I said we really have talked about the process if you're doing the interview with the applicant right there in the office with you. So if you're doing the application and the applicant is right there in the office with you, when you send your PE packet to DFACS, this is what we're talking about. So this is everything. This is sort of like a checklist that you need to make sure that you're including everything that you need to include before you send it over to DFACS. So when you're sending your PE packet over to DFACS, this is everything that should be included. You should, of course, have your 632. You should have your HIPAA notice, signature page only, signature page only, signature page only. You should have your notice of action, whether it was approved or denied. You should have the 94A. And any attachments, if it's applicable to the particular applicant. A copy of the notice of ADA. If applicable, the DMA 285 and a copy of the insurance card front and back if available. And if they come in and provide you with any type of verification, even though you don't need it for a PE determination, if they happen to give it to you, you just take it, make a copy of it, and send it as part of the PE packet to DFACS. So again, this is your regular PE packet. If you're doing it in the office with them, this is everything that you need to make sure that you have in your PE packet before you send it over to DFACS. Okay, now we're going to get in the part where we talk about PE manual updates. When do I do a PE manual? When do I complete a PE manual update? So these are the instances in which you should complete a PE manual update. Even if you do a PE manual update form, you still have to do the normal process, the PE process as normal. So you should never have the PE manual update by itself. It should always come with the 632. So that means you have to have made a PE determination for that particular individual. So, for instance, if for some reason you're not able to add the PE to GAMIS, and this comes sometimes, especially if an individual was pregnant and we have her due date already in the system, it may be an old due date or it may be the same due date. But if she's trying to apply for presumptive and we already have a date in there and it's been within 7 months, GAMIS is not going to allow you to add anything to that case for her. It's not going to allow you to add that PE. So in those instances, the error message is probably going to be like PE or pregnancy within the last 7 months. So if you receive that error message, you still complete the PE process as normal, but you're going to have to complete the PE manual update form in order for the PE to be added to GAMIS. That's the only step you're not going to be able to do because GAMIS is not going to allow you to enter it into GAMIS. We're going to have to add it to GAMIS manually. So that's when you have to complete a PE manual update form. If the P4HB needs to be terminated, remember if that person is active on P4HB 180 or 181, you need to complete the PE manual update form. If an individual has information in the system that needs to be updated and you could not update it because when you go through GAMIS and add them to GAMIS, you will have an opportunity to update information that needs to be updated. But some of the fields may be grayed out and you're not able to update it. For instance, I think like their first name, you're not going to be able to update that. So that's when you will have to complete a PE manual update form. Or either you may have added the information to GAMIS and you hit submit. After you hit submit, you realize either they forgot to tell you about an apartment number or you forgot to you spelled their name incorrectly or you put the name in backwards. Whatever it is, after you hit submit, you're not going to be able to go and change anything. So therefore, a PE manual update form has to be completed. So if you have any of those instances, a PE manual update form needs to be completed. If you go to slide 54, this is what the PE manual update form looks like. So up here at the top, of course, you're going to put the date that you're filling out the form, the date you're filling out the form for. Then you're going to check one of these 3 boxes, but you're always going to check the pregnant women PE. Right up under it, it says attach form 632. So that's telling you right there, when you send this as an attachment, you should have the 632 attached to it as well. And if applicable, the attachment A. Down here, you will not fill out the whole form. You're only going to fill out the areas or the fields that need to be updated. So for instance, in the scenario that I gave, if you have an error message, it gives you an error message, you went through the process, you're trying to add it to GAMIS, Gametes give you an error message that the pregnancy is within the last 7 months. That means you're not going to be able to add it to Gametes. So therefore, you're going to send this form along with the 632 to PE Corrections email address. And these are the fields that you need to fill out. The first field you need to complete is the field that says expected birth date of fetuses. Check the box right next to it, and on those lines, you're going to put what the due date is. The next field you need to check is number of births. Check the box right next to it. On the line, put how many she's expecting. The next field you need to complete, it says add PE to gametes. Check that box. On the line where it says PE period, you're going to give me the PE period, the date range. So if there's someone who applied today and was approved for the PE period, you're going to put September 30th, 21 through October 31st, 21. Then that's all you need to do. If nothing else needs to be updated, go down here, print your name, print your telephone number, and send this to the PE Corrections email address. That's it. If somebody's name needs to be updated, check the box where it says name, and on that line, put the name that it should be. Even if it's just the last name that needs to be updated or the first name that needs to be updated, go ahead and put the whole name. Then go down here, print your name and your telephone number. That's it. So only complete the fields that needs to be updated. You're not going to complete this whole form. Only complete the fields that needs to be updated. Once you have the form completed, remember, send it as an attachment. You're going to send that form along with the attachment A, if applicable, and the 632. Note down here, it says if the name, the date of birth, the social security number, or the citizenship needs to be updated, they're going to have to provide proof of that to us before we're actually able to update that. So if you're trying to update their name, date of birth, social security number, or citizenship, that's proof that we need to verify before we update that information. So you're going to have to provide us with proof of that. The PE manual update process is only for people that have been approved for presumptive or currently active on presumptive. If we get an update form and we go in and we see that this lady is active on full Medicaid, we're going to send a response back to you to let you know we're not doing any updates for this particular member, and they need to go to either DFAS to report any type of changes that they have. So this form is only for people already active or who have got approved for presumptive. Any questions over the PE manual update process? Okay. Now we're going to talk about an option that you have. Due to the COVID pandemic, we came up with another option for you all to continue to take PE applications while protecting your safety along with the member safety. So in that case, you have the option to take applications over the phone. So the applicant does not necessarily have to be in the office with you for them to apply. If they want to apply, your office has the option to take PE applications over the phone. So if you're taking PE applications over the phone, here's the particular procedures that you would need to take. First thing, we have an addendum. This is also called an attachment A, but this is an attachment A to the 632. So this is the addendum to the PE application. So the first page is your instructions. If you follow these instructions step by step, it tells you exactly what to do. The first thing, of course, you're going to interview your applicant over the phone to complete all your necessary forms. But the first thing you have to do is to screen them. That's what I should have put on there. First thing you need to do is to screen them. And once you screen them, then you're identify whether you're able to do the PE process or not. If you are, you're going to interview them over the phone, and you're going to be completing everything over the phone. So they're not there with you. They can't complete anything, and you're not going to send them anything to complete and send back to you. You're going to complete everything while they're over the phone with you. Inform them that she will also be applying for full Medicaid as well as presumptive. And then on the second page, these statements right here, this is what you need to read to your applicant verbatim. So you're going to read the first 4 paragraphs right here. And then right here, this first question says, do you understand and agree to these statements? And the applicant is going to have to give their verbal consent, yes or no. If they say yes, you need to check the box right here. Go down here, check this box where it says sign on behalf of. You're going to print the applicant's name. You're going to date it. You're going to print your name, and then you're going to sign it. That means she's giving you permission to process her application and sign on her behalf. This attachment A serves as the signature for all of the forms that usually are signed by the applicant. So it serves as the signature for the 632, the 5460, the DMA 285 if it's applicable, and also the 94A. So on the signature line for the applicants on those forms, just leave them blank. You do not have to put verbal special circumstances COVID-19. Don't put anything, leave it blank. Only thing you need to fill out is this right here. Once you fill this out, this needs to be a part of your PE packet that you send to DFACS. Once she's give her verbal consent, then you're going to determine whether she's eligible or ineligible. If she is eligible, you're going to add the PE to GAMIS. Then after that, you either need to email or mail your applicant this information. You're going to need to send them a copy of the temporary certificate. So once you add them to GAMIS, you print out the temporary certificate, the 634, the notice of action, if approved, or the denial if ineligible. The 5460, the HIPAA form, you're going to still keep the signature page, but it's really nothing going to be on it except for something I'm going to tell you to put on it in just a moment. But all the other pages should be going to your applicant. A copy of the notice of ADA, and then a copy of page 2 of this attachment. So this is everything you need to be sending back to your applicant, whether you email it or whether you mail it back to them. So you're going to send all of this back to your applicant. And then within 5 days, you're going to send the PE packet to DFACS. So the telephonic signature process, I just went over it. This is right here. So if you're doing this via telephone, these are the procedures that you take for the telephonic process. And I don't want to have to reiterate this, but I just went over those steps. So if you're doing the application over the phone, so when you send your PE packet to DFACS, this is what should be included in your PE packet if it's a telephonic signature application. So of course, your 632, your 634, either approval or denial, the signature page of the HIPAA form. So on the signature page for a telephonic application, you're going to write on there email to applicant or either mail to applicant. So that tells us that you either emailed this copy to your applicant or either you mailed it. Don't put anything else, just email to applicant or mail to applicant. That goes on the signature page that you're going to put in your PE packet. Copy of the notice of ADA, the attachment A that you signed on their behalf, the 94A, and then the DMA 285 if applicable. Are there any questions over what should be included in your PE packet, whether you do the interview in the office with you with the applicant in the office with you or whether you do it over the phone. Are there any questions over any of those procedures or the PE packet that you're sending to DFACS?
We're clear in the chat.
Thank you. Okay, what are the reasons why someone can be denied for this program? Of course, if they're not a U.S. citizen, national, or qualified immigrant, if they are not a Georgia resident, they are not pregnant, they are over the income limit, even after the, if applicable, the pre-tax and 1040 deduction, and also after the 5% deduction, they're still over the income limit. And then if you have someone who is not cooperating with you, they refuse to give you any type of information that you need in order to make a correct PE determination, then you will have to deny that application. So on the 634, when you click on that drop-down box, you're going to have to choose one of these 5 reasons why you denied that application. Okay. So we have a couple examples that we're going to go through. We have a scenario that is going to be presented to you. I'm going to show you the step-by-step process of what you need to do. We're going to determine the budget group. We're going to determine the income, and we're going to fill out the application. And we also have one example, I think it maybe does some well. We have to fill out the PE manual update form and also the attachment A. So that's what we're going to be looking at. So how to determine eligibility for a pregnant woman? Remember, the eligibility criteria goes off of their tax filer, non-tax filer status, and if they are a tax dependent, if they meet an exception that we went over in that budget group flow chart, making sure their income meets the income limit, making sure that they are a Georgia resident, making sure they are a U.S. citizen, national, or qualified immigrant, making sure they are pregnant, and they can only be approved once per pregnancy. Okay. Let's get to our examples. Sorry. Can I have someone to read example 1, please?
I will. Mercedes Harry, 43, is 12 weeks pregnant with twins. She lives with her husband, Kodak, 41, and their son, Kodak Jr., 13. Mercedes works at Lowe's and earns $34 per hour at 40 hours per week. She is paid every week. Kodak does not work. Mercedes pays $29 per week for health insurance and $16 per week for dental insurance for the family. She states she intends to file taxes jointly with her husband and claim Kodak Jr. as a tax dependent. Mercedes calls and wants to apply for PE.
Okay, so let's look at our step-by-step process of what we need to do. Thank you, Valenia, for reading that. So the first thing we're going to do is we're going to screen Miss Mercedes in GAMIS and see what GAMIS is going to show us. So in this case, let's just say we screen her and GAMIS is showing that she's inactive, but she's had Medicaid before in Georgia. So it gave us her ID number. So we're going to write down her ID number. So on your PE application, I think it's like the couple, maybe 3 slides over, you have a blank PE application we're going to fill out. You can go ahead and write this number down at the top right-hand corner where it says medical assistance ID number. That is her ID number we're going to use. It's 12 digits long, so it's going to be 1, 2, and 11 zeros. We're going to complete, that means we could go ahead and complete the PE process. So we're going to complete her process. We're going to interview her and complete the 632. Now she's calling. Remember, this is the application we're doing over the phone. So that means we need to have that attachment A available. So we're going to read those statements on page 2 verbatim to Mercedes, and she's going to have to give her verbal consent. Once she say yes, it is okay for you to go ahead and process my application. Then we're going to complete the attachment A and sign on her behalf. Then we're going to make a determination based off of the information she gave us on the 632 to see if she's going to be eligible or ineligible. Let's say she is eligible, and let's say we go through the process. We've completed all the forms. Then let's say we go through the process of trying to add her to GAMIS. And when we try to add her to GAMIS, GAMIS is giving us this error message. It says previous pregnancy within the last 7 months. So that tells you right there, there's an extra step you need to do is to complete the PE manual update form because you're not able to add it to GAMIS. So we're going to complete the 94A in the DMA on her behalf. We're completing the 94A, which is the full Medicaid application. And we're going to complete the DMA 285 on her behalf because she has other health insurance. And then after that, we're going to email or mail Mercedes her approval notice, the HIPAA notice, the privacy practice notice. It's up at the signature page. And we're going to send her a copy of the notice of the ADA and a copy of the signed attachment A. That's everything that we need to email or mail Mercedes. You're going to inform her what her PE period is and that you're sending her full application to DFACS for processing. Then that's when we need to complete the PE manual update form. And you're going to send that completed form along with the 632 and the attachment A to the PE corrections email address. Within 5 business days, you send your packet to DFACS, and this is what should be included in your PE packet. You should have your 632, your 634, the 5460 signature page only, and you wrote on there either you emailed it to the applicant or you mailed it to the applicant. The DMA 285, the 94A, the notice of ADA, and the signed attachment A. Any questions over the steps? So that's everything. If you follow those steps, you'll be in a good position. That's everything that you need to do. And this is for an application that's done over the phone. Okay. So let's determine who's all in our budget group. Can anybody tell me who's in this budget group? How many do we have in this budget group? You can type it in the chat or you can take yourself off mute.
5.
Thank you. Somebody said 5, and in the chat, I'm saying 5 as well. That is correct. We have a budget group of 5. Remember, she's filing taxes jointly with her husband and claiming the son as a tax dependent, and she is pregnant with twins. So it should be a budget group of 5. So now let's look at her income. Is there any income? Who had the income?
She does.
Right, she does. And how much income did she have? Like, can you read us what her income was? Go back to slide 64, I think.
She said she gets $34 per hour at 40 hours
And she's paid how often?
per week.
Okay, thank you. So that means we got some calculation that we need to do. She's paid $34 an hour. She works 40 hours a week and she's paid every week. So for her income, what you're going to do is you're going to multiply 34 times 40, and that should give you $1,360. She's paid every week, so you take that $1,360 multiplied by 4.3333, and her income right now stands at $5,893.28. So when you go to your PE application, you're not gonna put $34 in the amount field. You're gonna put $13.60. And then for the frequency field, you're gonna put weekly. And then a monthly amount field, you're gonna put the $5,893.28. Because if you try to put the $34, you're not telling me there's no space to put the number of hours, so I can make sure that your calculation is correct. So you need to go ahead and multiply the hours by the hourly rate to come up with the calculation and put that in the amount field. And then for the monthly amount, you convert it over and put the monthly amount. Is there anything else we need to do to her income? Did she have any taxes or, deductions or anything?
She has health insurance and dental insurance.
Okay, and how much was the health insurance? That was she was paying?
$29.
And how often?
Weekly.
Per week. And so the conversion factors for weekly is that 4.3333. So for the health insurance, you multiply 29 times 4.3333, and you should get $125.66. Is there any other deduction that we need to convert?
Her dental,
She has dental as well.
Okay, and how much was that and how often?
$16 per week.
Correct. So you take that $16 and multiply it by 4.3333. And her monthly amount for the dental insurance is $69.33. Okay, is everybody okay so far? Have I lost anybody so far? And now we need to subtract the health insurance and dental insurance from her income. So her income, when we convert it, is $5,893.28. And then the health insurance and dental insurance, you just add that up together, and it came out to $194.99. You subtract that from her income, and her income is $5,698.29.
Anita, we have a question in the chat that says, how do we proceed if a patient does not know if it's before or after taxes?
You can't take it off unless they tell you it has to be before taxes. That's information that you would need in order to make a correct P determination. So if they don't know it, you cannot subtract it off of their income. They have to know it if it's before or after taxes. Okay, so if you pull out your income limit chart and go to a budget group of 5, can anybody tell me what the income limit is for a budget group of 5?
$5,691.
$5,691. Is she over?
Yes, yes, she is.
Yes.
Okay, so what do we need to do to try to see if she may be eligible?
We can deduct $130.
A 5% deduction.
That is correct. You're going to subtract the 5% deduction, and the 5% deduction for a budget group of 5 is $130. So you're going to subtract $130 from this $5,698.29, and her income drops down to $5,568.29. Let us compare that back to the income limit of $5,691. Is she now eligible?
She is.
That is correct. Now she's eligible. Any questions over the income and the deductions? Does everybody have this written down, because we're about to fill out our PE application?
Can you give me about a minute to complete finishing writing it down?
Sure, no problem.
Thank you. Thank you.
You're welcome. Anybody else need more time? Okay. So go ahead and pull out your 632, which is on slide 70. I'm sorry, somebody needed 2 more minutes. Hold on. Let me go back. If you already have this information, go ahead and use slide 68 and 69 to try to fill out your PE application. Okay, I'm going to move to the next slide. This is the information you need to start filling out your PE application. I'll give you a couple of minutes. You may not finish. I'll just give everybody a couple of minutes to try to start on their own, and we'll go over it. Give everybody about 1 more minute and we'll go over it. Okay. Don't worry about it if you didn't finish. That's okay. We're going to go over it together. So begin, month, date, and year. That's always the application date. Is not the PE period time. It's not going to be a date range. It's going to be just the date that they applied. So for her, it should be 3/2/21. Her application, her ID number from Gammas, we received that when we screened her. So we're going to use that same ID number. So it's the number 2 with 11 zeros following. And then her demographic information goes at the top, her name, her address, apartment number or lot number if they have one, the city, the state, zip code, county of residence. Does everybody have that so far?
Yes, ma'am.
Okay. Next, add the telephone number. Social Security number, if they give it to you, that's fine. You go ahead and put it in, but it is optional. It's not required for PE, but they will be required to give it for the full application. Right here, it says that means health insurance, yes or no. So you're going to ask, do you have other private health insurance? They're going to either say yes or no. If you say yes, that means you need to complete the DMA 285. So in this case, she did, remember, because she was paying $29 a week for health insurance. So we're going to check a yes here. So can anybody tell me, was this a tax filer household or a non-tax filer household?
Tax filer.
That is correct. Remember, she was filing taxes jointly with her husband, so they're considered a tax filer household. So you're going to check the box next to yes for tax filer household. So that means either yes, they are a tax filer household, or if they were a non-tax filer household, I would have checked the yes box for non-tax filer household. So that means you need to have a yes check for either tax filer household or non-tax filer household. Does everybody understand that part?
Yes.
Thank you. So now we're ready to put the people that's supposed to be in her budget group, we're ready to put their information on this application. So on line 1, it should always be the applicant, the person that you put up here. So her information is going to go on line 1. We have her name, her date of birth, her gender, her race, and she's the one with the income. So that means now we need to add the income on her line. If her husband was the one with the income, we would add the income on his line. So she's the one with the income, she's working, and up here it gave you some abbreviations that you can use. So she's working, so you could put a W, or either if you want to use E for earned income, that's fine, but I gave you some abbreviations up here to use. So we're going to use W for type. The amount, remember she was working at Lowe's, making $34 an hour, working 40 hours a week, and she's paid every week. Remember, I told you to go ahead and multiply that 34 times 40 and then put that amount in the amount field. So in the amount field should be $13.60. For our frequency column, she's paid every week. So we're going to put W or either WK. The monthly amount, so that tells us this amount has to be converted over to a monthly amount because the frequency is weekly. So you're going to take that 1360 and multiply by 4.3333, which we did earlier, and that amount is $5,893.28. Next, the pre-tax deduction. This has to be in a monthly amount. She had the health insurance and the dental insurance. So once you have converted each one of those, you add them up together, and that's the amount you put on this line. So together, the health and dental insurance amount came out to be $194.99. And then from here, you know to subtract your pre-tax deduction from this monthly amount field. And that came out to be $5,698.29. Any questions so far?
No.
Thank you. Line 2, are you a U.S. citizen, national, or lawful present immigrant? She was a U.S. citizen, so we're going to check the box for yes. Line 3 and 4, we're going to add her son and her husband. Doesn't matter what order you put them in. I just added the husband on line 3. So you're going to put his name, his date of birth, his gender, his race, and what is his relation to the applicant. And then her son, put his name, his date of birth, his gender, his race, and his relation. Okay, so now we're ready to complete. There's everybody that we have to put on that application besides the pregnancy information. We put that down here. So down here, we're going to finish completing the income section. So for your subtotal net income field, you're going to add up everything that's in this last column where it says monthly net income. So everything that you have in this last column, you're going to add it up and bring it down here. The only one that has income, so that same amount should come down here where it says subtotal net income. So it's still $5,698.29. And the number in the budget group was 5 because it's 3 individuals right here and then the twins. So it's 5. Poverty income level, that is the income limit off of your chart. For a budget group of 5, the income limit was $5,691. Did we have to subtract the 5% deduction? Yes, we did. So we're going to put $130 on that line. If you do not have to use the 5% deduction, leave that field blank. So now we're ready to subtract that $130 from that $5,698.29, and you get $5,568.29. Compare that to the income limit. She is eligible. So we're going to check the box right here where it says eligible. And now we need to input the pregnancy information. How many weeks she's pregnant? 12. How many she's expecting? 2. And what is her due date? 9/1/2021. And then right here it says I have obtained a medical assistance application from the applicant and forwarded it to the DFACS office. This box should always be checked. You're going to let your applicant read this sworn statement right here. If it's over the phone, you're going to have to read it to them because they're going to have to understand, declare, agree what they are declaring to. Once they do that, if they're in the office with you, they will date it and sign it. And then you're going to complete your information down here. You're going to put the date, print your name, put your title, put your telephone number, sign it, the name of your health department and address, and the provide ID number. Make sure you put the name and address of your health department. When errors come in, people leave off the name of the health department. They just give me the address. I need the health department name and the address. So now, since this application was done over the phone, you need to do the attachment A. But before we go there, is there any questions over this PE application?
No.
Thank you. So for the attachment A, remember, you have to read these statements verbatim to your client. Then you have to ask them this question. Do you understand and agree to these statements? They say yes, check yes. If they say no, you're going to check no, and then you're going to have to read them this second question. Should I cancel this application? Because without your authorization, we are not able to process your application. This is giving them a second chance to give us the go-ahead to process their application. So if they say yes, you don't have to ask the second question. You go down here and sign on their behalf, putting the name of the applicant, the date, print your name, and then you're going to sign it. Any questions over the attachment A? Okay. Remember, when we tried to put this into Gammas, it was giving us this error message, pregnancy within the last 7 months. So that means you've done everything, but the only thing you couldn't do is to add the PE to Gammas. So what you need to do now is you need to complete this update form, send this form along with the 632 and the attachment A, because we did this application over the phone. So there are 3 documents that you need to be sending as part of your email. So let's fill this form out. We're going to put the date. The date should be 3/2/21. Check the box where it says pregnant women PE. And these are the fields that you need to complete in order to let DCH know that we need to add this PE to Gammas. So the first fields we're going to complete is the expected date of fetuses. You're going to put what the due date is. The next field is number of births. Check the box, put how many she's expecting. And then the next field you need to complete where it says add PE to Gammas, check that box and then give me the PE period. Once you've done that, go down, print your name, print your telephone number, send this form along with the 632 and the attachment A to the PE corrections email box. And then in a separate email, if you're emailable, if you're faxing or whatever, send your PE packet to DFAX. You do not have to include the PE manual update form when you're sending that to DFAX. Any questions over example 1? Okay, silence means no. So
I
let's
have
go.
a question. Sorry, we have to go to the laptop. Could you go back to slide 70, the completed version of it?
One moment. I have to go through all last viewed. 70.
Yes, ma'am. So for the qualified provider number, that's our ID number?
That's the health department number. Like when your actual health department became a Medicaid provider, they are associated with a provider ID number.
Okay, thank you, ma'am.
You're welcome. Any other questions? Hold on, y'all. Okay. Can I get someone to read our last example?
I'll read it.
Thank you.
Tan Ham, 18, who was pregnant with 1 child, lives with her mother, Tan Ham, 51. San's boyfriend, Pike, 20, also lives in the home. San is unemployed, but her mother works and earns $2,500 every 2 weeks. San's boyfriend also works and earns $346 every 2 weeks. There are no pre-tax or 1040 deductions. No one in the household will file taxes, and San is not being claimed as a tax dependent. San states that no one has other health insurance. San comes into the office to apply for PE.
Thank you. So let's go through our step-by-step process of what you need to do. First thing you need to do is to screen SAN and gametes to see what it tells us. When we screen her, it's showing us that nothing is coming up. So that means that she never had Medicaid in Georgia before. So when we go in to add her to gametes, gametes will create an ID number for her. And once you have added it to gametes, and then at the end, once you hit submit, gametes will show you what her ID number is, and you will write that ID number down on the PE application. So we're going to complete the 632 and all the other required forms. We're going to determine if she's going to be eligible or ineligible. And with this situation, we're going to see that we're going to be denying her, and we'll see why we're going to be denying her. So in this instance, you're going to give her the denial notice, the HIPAA notice, the notice of ADA, and the P4HB information. Inform her that if her circumstances changes, she can come back and reapply. And then within 5 business days, you need to be sending your PE packet to DFACS, and this is what should be included. Your 632, your 634, the 5460, the signature page only, the 94A, the notice of ADA. Any questions over the steps? Can anybody tell me, if you go back to your slides, to the scenario slide, make sure you read that carefully. I'll read it again so we can determine who's all in the budget group. Sanham, 18, who is pregnant with 1 child. She lives with her mother, 10, and also her boyfriend, 20. Pike, who's 20. No one in the household will file taxes, and San is not being claimed as a tax dependent. So can anybody tell me, you can type it in the chat or you can take yourself off mute, how many are in the budget group and who is in the budget group?
Is it 4?
Okay, I have 4. I have somebody in the chat that said 3. If you need to pull out your budget group flow chart, pull out your budget group flow chart. I have 4, I have 3, and I have 2. First, let me go back. First question, is this a tax filer household or a non-tax filer household? That's the first question I should ask. Can anybody tell me if this is a tax filer household or a non-tax filer household?
A non?
Non-tax filer household. And saying she's the one that is applying. She's 18. She's under the age of 19. So that means she's considered a child. So if you look at the box that says non-file, apply non-filer rules for a child, who should be in the budget group for the child?
What slot number is that to look at?
Oh, I can't tell you what slide number. It's the budget group flow chart.
Okay,
37.
Thank you. 37.
thank you.
Bob would be.
Okay. So the
Three.
correct answer, I'm sorry, somebody was going to say something.
Is the correct answer 3?
Yep. Correct answer is 3. It's San, Tan, and her unborn child. Again, go back to your budget group flow chart. It says she's not filing taxes and she's not being claimed as a tax dependent. So the arrow is pointing to no to the box that says apply non-filer rules. She's under the age of 19, so she's still considered a child for Medicaid purposes. So for a child, it says include the child, child's parents if living together, child's siblings under the age of 19 if living together, and the unborn fetuses. Pike is not included because it didn't say anything about a boyfriend. It said the child, child's parents if living together, child's siblings under the age of 19 living together, and the unborn fetus. So it should be a budget group of 3. Income. Is there any income that we need to count? And who has the income?
The mother.
Correct. And how much does she?
Says she earns 2,500 every 2 weeks.
Thank you, Ms. Martinez, for your participation. She earns $2,500 every 2 weeks. So what we're going to do is convert that amount over to a monthly amount by multiplying by 2.1666. And her income is $5,416.50. Are there any pre-tax or 1040 deductions? Anybody besides Ms. Martinez? There any pre-tax or 1040 deductions?
No.
That is correct. So we're going to compare this income to the income limit chart. So if you look at your income limit chart, what is the income limit for a budget group of 3?
$4,026.
$4,026.
Thank you, Ms. Martinez. Thank you, Ms. Julie. That is $4,026. And thank you for the ones that are participating in the chat. So if we compare her income to the income limit, that's making San over right now, right? So what do we need to do to try to see if she may be eligible?
Apply the 5% deduction of $92.
That is correct. We're going to subtract the $92, which is the 5% deduction for a budget group of 3. Subtract that off of the income. The income is now $5,324.50. Now we're going to compare that amount back to the income limit. Is she eligible?
No.
No. So this application is going to be denied for over the income limit.
I typed no. It just didn't get on.
Anybody had a question? Anybody need more time to write this down? For the ones that are ready, you can go ahead and start filling out your PE application. I give about another minute for people to write this part down. Okay, here's your application information. We're going to go right at 2 o'clock, so I'll give you a couple of minutes. Okay, go ahead and look at it. So our application date is 3/22/21. We're not gonna have an ID number because she was not known to the system and we did not approve her. So that field is going to be blank. So we're gonna put her information, Sandham, her name, her address, her county of residence, and her phone number. And for other health insurance, nobody had other health insurance, so that box is going to be checked as no. No one was filing taxes and she was not being claimed as a tax dependent, so we determined that this is a non-tax filer household. So we're going to check the box for yes for non-tax filer household. San is the one applying, so her information goes on line 1. Her name, date of birth, gender, race. Did she have income?
No.
No, so that means there's nothing else we need to put on her line. And then we have to ask about the U.S. citizen, national, or a lawful present immigrant. She is, so we're going to check the box for yes. We're going to put her mom on line 3. Her mom's name, date of birth, gender, race. Her relation to applicant, that's her mother. Her mother is the one with the income, so now we're ready to fill out the income information on her mom's line. So the type is going to be W. The amount is going to be $2,500. Her frequency is going to be biweekly, so you can put a B or a BW. It's going to be $5,416.50 because we had to convert that $2,500 over to a monthly amount by multiplying it by 2.1666. They didn't have any pre-tax or 1040 deductions, so those fields are going to be blank. And your monthly net income is still the same, $5,416.50. There is nobody else that we need to add on this application, so we're going to go ahead and complete the income field. So your subtotal net income is still $5,416.50. The number in the budget group should be 3. The income limit or the poverty income level is 4,026. We did have to use the 5% deduction again, so that's $92. So your total net income is $5,324.50. And based off of this, with all the deduction, with the 5% deduction, she's still over. So we're going to check the box for ineligible. She is 20 weeks pregnant with 1 child. Due date is 7/30/21. Check the box that we did obtain a medical assistance application and sent it to DFACS. Your applicant needs to read this sworn statement, date it, sign it, and then you need to put your information down here at the bottom. So this is a denied application. Any questions over the denied application?
So just to be clear, we don't have to put the medical assistant number even if we knew it.
You can, but it really doesn't matter. If you want to, you can go ahead and put it on there, but as long as you check the box for ineligible. So I know if I'm auditing this application and I try to pull it up, then it's going to be questions if you don't check ineligible. But as long as you check ineligible, that's fine. It really doesn't matter.
Okay.
Any other questions? Alrighty. So is everybody okay with the two examples that we've done? We wanted to make sure that you had an opportunity just to be comfortable, especially for the new employees, to be comfortable, making sure you understand how to fill out a PE application, and then also how to fill out an attachment A if it's done over the phone, and then also how to fill out a PE manual update if that needs to be updated. So now we're going to look at gamuts. So the first thing we've been talking about this whole time is that you must screen the individual into gamuts to first see what gamuts it's going to show us. So the website that you need to go to, if you don't already know it, is www.mmis.georgia, spelled all the way out, GEORGIA.gov. Once you go to that website, if you don't have access to gamuts, you will need access to gamuts, and that comes from your administrator of your facility. If you're having any issues with getting that access from your administrator or either from Gainwell, please send me an email to let me know, and I would try to have to reach out to try to search and see who we can get to get the access that we need for people that needs to do these presumptive applications. So once you go to the screen, you're going to click on eligibility. And then your eligibility verification request is going to come up. So you're either going to put in their ID number if they already know it, their first and last name or gender, date of birth, or the social security number. And then you're going to put the from and through date of service. Once you do that, you're going to click on search. Once you click on search, if the individual was known to the system, their information that we last had for them will populate right here. So now it's giving us her ID number, so we will write that ID number down. And this right here is going to show you what address and stuff we had for them. So if this is an address that needs to be updated, you need to make sure once you go in to add this person that you need to update this address before you hit submit. So down here, it will show you the eligibility by service type. So the status will tell you whether they're active or inactive. So in this scenario, the individual was inactive. So that means we could go ahead and start the PE process. If the status showed active, then you need to come over here where it says aid category to determine what aid category they're active on. So depending on what aid category they're active on, remember, pull out the PE procedures section to determine what steps you need to take. So once you determine, you can go ahead and do the PE process, go ahead and start your interview, completing the PE application and all the other required forms. Make a determination to see if this individual is going to be eligible or ineligible. Sorry, go back. If the individual is eligible and you've done all of the paperwork, now you're ready to enter this information into gamuts. So you're going to go back to the home screen because you have to sign in. You're going to click on presumptive activations, and then you're going to click on where it says pregnant women activations. Once you click on pregnant women activations, if the member already has an ID number and you have it, go ahead and type it in right here where it says member ID number, press enter. If they don't have a member ID number, go ahead and start filling all this information in and leave the member ID number field blank. So that means that they were not known to the system and gamuts needs to create them an ID number. So if they have one, you will put it in and press enter. If they have one and you press enter, this is going to populate with the information that we have. So you're going to start either updating or go ahead and completing these fields. So the net taxable income is that last field you've seen on your 632 where it says total net income. That's the amount that you put here. And then you're going to fill all this information out with her demographic information. Notice the first name, the date of birth, and the social security number is grayed out. That's because those 3 particular fields cannot be updated by you. So if that's the case and it needs to be updated, that's when you will have to complete a PE manual update form to have those fields updated. Go ahead and fill everything out. Demographic information, mailing address, residential address. If it's the same as mailing address, check the box. Down here, Medicaid application submitted. This should always be a yes because this is pertaining to the 632. Put in your application date, and really your application date in this eligibility begin date should be the same, but the eligibility begin date is already populated by the computer. So those 2 dates really should be the same because remember, you need to be doing this on the same date because that's the reason for presumptive for them to get a determination the same day. You're going to put in the due date and the number she's expecting. Before you hit submit, you need to make sure you review this information. Once you have reviewed this information in its entirety, you're going to hit submit. Once you hit submit, it will say that request was successfully processed. If they need an ID number, it will show right here. And then if to get their temporary certificate, you're going to click on this link that says Certificate of Eligibility. Click on that, and that should populate another window with their temporary certificate that you would need to print out. And you just start that process over for your next applicant. Any questions over GAMIS? Okay, our next section, we're going to talk about audits. So like I said, the audits have started back beginning this year. So just be mindful. You might not get audited for a minute because I'm going to eventually audit everybody, but just be mindful just to do all your applications right each and every time, and you won't have any issues with it. If you follow everything that you have received in this training today, you should not have any issues. You even have 2 examples to refer back to that we went through to make sure you understand how to complete the particular form. So you shouldn't have any issues off of that. So what I usually do for the audit process, I'm going to reach out to PE coordinators each month, and then they're going to decide what counties out of their districts will be audited that month. So they're just randomly pick how many ever I ask for. If I ask for 2 out of district 3, then that's what they're going to send me. They're going to send me over to, they're going to reach out to you all and say, hey, I need you to send a PE packet from whatever particular month. I need you to send that directly to Kenita, or either send it to me and I'll send it to Kenita. So if they reach out to you at some point, please be mindful that you need to make sure you send your PE packet to be audited for that particular month. If a PE coordinator reach out to you and you did not do applications that month, please let them know that, and they can relay that information back to me, and then we'll just have to get you on the next month. Once I get the PE packet, I will go through my audit form, and I'll show you what the audit form looks like. So this is what the audit form looks like. This is what you're going to receive back. So it's going to tell you whether you passed or whether you failed that particular area. If you failed that particular area, then in the last columns, I try to give you some comments or either details of why you failed that particular area. So it's telling you the 632, it must be the updated version, which was revised on 8/30/21. Do you have your effective for services begin date? Do you have the application date? Do you have the applicant's name and address? Do you have the medical assistance ID number? And that can be if applicable, because if they're denied, you really don't have to have it. Health insurance box, was that checked? Tax filer, non-tax filer, was that box checked? Did you check the box about the US citizen, lawfully present immigrant question? Income, did you calculate it correctly? Did you round? Did you use the deductions correctly? Did you use the 5% deduction when you shouldn't have used it? Did you put the correct people in the budget group? If there are 5 people, you put 5 people in the budget group, or there are 5 people listed in the budget group? Did you list the right income limit? Remember, using 2021 income limits. Did you check the box to let us know if they're eligible or ineligible? Did you input the pregnancy information, the weeks, the number of fetuses, the date? Did you check the box where you say you obtained a medical assistance application and forwarded to DFACS? If applicable, did the applicant sign and date it? Because I know if they didn't sign and date it, you're still supposed to have the attachment A. And then did you list all of your information? Meaning you got the date, you printed your name, you put your phone number, you put your title, you signed it, you put the name of your health department and address and the ID number. If any one of those are missing, it can be a fail. Then your PE packet. Do you have the 634, either the approval or the denial? Do you have the signature page of the HIPAA form? Do you have the 94A? Do you have a copy of the notice of ADA? If applicable, do you have the DMA 285 or the attachment A? So this is kind of like a checklist for you all. So if you go through this and check this off, that means your application should be fine. But this is what you're going to receive if you are audited for a particular month. This is the actual form that you're going to receive, letting you know whether you pass or fail that particular area. Right now, I'm sorry, go ahead.
Oh, Kenita, excuse me. I'm sorry. There's 2 questions in the chat. One from Shirley. Who would give us access to GAMIS?
I just said that if they don't have access, that comes directly from your administrator that actually set up the accounts through Gainwell Technologies, because they have the administrator of your particular facility. They actually have the rights to go in and sign up, request access for people that need that access. But if you have to go through your administrator, because we don't really give access, and that actually comes through provider enrollment, we don't give access, but I can try to help point you all in the right direction of who you need to reach out to. So reach out to your administrator first. If you all have went through Gainwell and you're not getting any help or anything like that, you're really having trouble getting the access, then send me an email and I can see how we can route that question over to Gainwell to get that addressed.
Also, Kenita, if you could look in the chat, there's a message from Connie. It's kind of long, and probably easier for you to read it.
Can you go over attachment A a little more? If we have a client that is not sure how to answer some of the questions on this form, can they leave it blank? For example, first page number 10, if they don't know who we contact about health coverage, or if this is insurance through a parent and they don't know the information, how would we, this is not all, you talking about the attachment A of the 94A? Connie, let me know if you're talking about the attachment A of the 94A, because I'm thinking about the attachment A for the 632. So for the attachment A, they don't, like the attachment A and the DMA 285, if they don't know that information, they just need to fill it out to the best of their ability, because it's really the insurance card that TPL wants, because that really gets that information, but they just give us whatever information they have, and that's why we have a vendor that actually goes in and investigate to get all the necessary information that they need. So you're correct in telling them to fill it out the best information that they have. Any other questions?
That's good for the chat.
Okay, so for the audit forms right now, if you fail it, I'm just asking you to make sure you review your audit to make sure you understand why you failed that particular area. If you have any questions, make sure you reach back out to me. But if you continuously to be audited and you're making the same mistakes, that will be addressed with you and your PE coordinator to figure out what's the next steps that we need to do. If you need to come back through training, just stop doing PE for a while, like we will determine what needs to happen next. There will be more specific information coming out about audits in the year 2022. We're just trying to kind of start this back up, but you will have more and more information about what will be the next step if an employee continues to make the same mistakes. Are there any questions over the audits? Okay, this is the website again to GAMIS Web Portal. This is where you can get your forms that we went over today. The only form you can't get on here is the attachment A to the addendum. You still have to print out the one that I gave you, and then the 94A. The 94A, if you need copies of those can be ordered through DFAX. If your office does not have the 94A form, please continue to print off the ones that you have, or to the one that you have from the email, or either reach out to me and I can let you know who you would need to reach out to at DFAX to get those ordered. But all the other forms, you should be able to print those off of the web portal. Also, this is where your pregnant women policy manual is housed. So if you need to go there to get clarification on something or you don't understand something, please make sure you go to the website and go to provider information. And then this time you're going to go to provider manuals and look for the one that says pregnant women PE. Remember, ordering the booklets, you go through Gainwell Technologies. Everything that you received today has been policy related. So my team, my colleagues, my department, we handle the policy in order to get someone eligible for Medicaid. If you have an issue, or if a member is having an issue with their doctor in regards to the billing or claiming issues, then that is something that they need to either submit to or contact Gainwell Technologies about. So if the provider needs more information, more clarification in regards to billing or claims, they need to reach out to the Gainwell's Providers Contact Center. They can call the 1-800 number, or either when they go on the website, there is a web portal contact feature that is like a form that they fill out, and then their field representative, whoever their field representative is for that particular facility, should reach out to them. And also, if you're having issues in getting a hold to somebody, if you haven't tried this feature right here, before you reach out to me, try this feature right here. Go to this web address right here, fill out the form, submit it back, let them know what your issue is, submit it. And then once it's submitted, somebody should get in contact with you. So that person is like your field representative. So they should be helping you in the process of getting anything that you need in regards to access to Gainwell. So if you haven't tried this part right here, before you email me, try this part right here to see if the issue gets resolved. Then if it doesn't, then reach out to me. Okay, so this concludes our training for today, especially for our veteran workers. So if you are a veteran worker, meaning you are already doing this process, you just came to training just for a refresher, you have nothing else to do. If you want to go ahead and leave, you are more than welcome to go ahead and drop off. The next couple of slides is just for my new employees. So if you're taking this class for the very first time, you've never done PE before, that means you're considered a new employee. So if you're a new employee, remember I told you at the beginning of class, you're going to have to take an assessment after this, and you're going to have to pass it with the 80% or higher before I approve you to start making PE determinations. So this is how you get your assessment. And I need everybody, if you are a new employee, I need you to pull out slides 92 and slides 93 and put it right there in front of you. So slide 92 telling you if you need to get your assessment, because nobody has their assessment at this point, because I did not include it in any of the emails that I sent out. So this is how you're going to get your assessment. After you get off of this training today, you're going to go back to your desk and you're going to send me an email saying that you attended class and you need the assessment. I will reply back to you with your assessment, okay? Again, if you are a new employee, in order to get your assessment, you need to email me after you get back to your desk to let me know you attended class, and then I will reply back to you with your assessment. Then after that, you're going to be emailing me 3 documents. Do not send me these documents separately. I need one email with 3 documents attached to the email. So the first document is your statement of completion of required PE training. So in your training email, there was a form called statement of completion of required PE training. You need to complete that form in its entirety. It asks for your name, your provider ID number, and it lists all the training materials that you should have received. I need you to initial beside everything that you receive. Then you need to read the statements. If you agree to it, you need to sign off on it. And then you need to have your supervisor or your PE coordinator sign off on it as well. Also, there is a sign-in sheet that was attached to the training email. You need to complete that as well. New employees only. Better employees, you do not have to sign the sign-in sheet. And then, of course, your assessment. So when you send me an email, I should only have one email from you with 3 attachments or either 3 documents in that attachment. You should have your sign-in sheet, you should have your assessment, and you should have your statement of completion training form where it's completed by you and also signed by your supervisor or PE coordinator. Now I say send all this information. You can send it to your PE coordinator and your PE coordinator can send everything to me, or you can just send everything to me if you want to as well. So you have 2 options. Send it to your coordinator, everything to your coordinator, they have sent it to me, or either you can send me everything in one email, everything in one email. This is my contact information. If you have any questions, I try to prefer you to reach out to your PE coordinator first, but I know it's just so much going on. If you just really need my help, go ahead and feel free to reach out to me. Please try to reach out to me first via email. And that's because most of the times we're in a lot of meetings and it's hard for me to try to answer my phone. But if you email me, I'm able to look at my emails while I'm in a meeting, so I'm able to respond back a little bit quicker via email. But if you can't get me via email, then you can try to get me by phone. Please do not give out my information to anybody. This is for your use only. Don't give it out to any other coworkers that are not part of Presumptive. Don't give it out to members or applicants. This is for your information only. If for some reason I'm not in the office, and I will have my reply on to let you know I'm not in the office, then I have my colleague who's my backup, and vice versa. Her backup as well when she's out of the office. That is Miss Fair, the one that has been greatly monitoring the chat for us and answering questions. So if I'm out of the office at any time and you need some questions answered, please reach out to Miss Fair. And then again, please do not give out her contact information either. So this concludes the training for today for presumptive eligibility for pregnant women. I thank you all for your participation, whether you participated via chat or you participated verbally. I really appreciate it. I hope you got everything that you need. If you go back to your desk and you feel like you have a little bit more questions, you can always email me and I can try to reach out to you. So I'm going to stop and pause here to see if anybody else had any questions. And then if so, I will stay on for a couple more minutes to answer any questions. But I'm going to stop the recording now. But if you have any questions, please let us know. If not, you feel free to go. And I thank you for your time and hope you enjoy the rest of your day.